Thanks for staying with us at STL Live. I'm Sarah Bernard, and I'm talking to Jorge Riopedre of Casa de Salud organization, medical care facility here in St. Louis, Compton, and Choteau. And you're serving on average about 400 patients uninsured from our community each month. Cool. So let's talk about funding. Obviously, you're getting funding from somewhere, grants, that kind of thing. Let's talk about that a little bit.
Right. First is the in-kind funding, which is to say that our building is owned by St. Louis University, and they allow us to use it rent-free. That's one of the reasons that we can keep the cost down to just $25 per patient. General fund, then cash funding after that largely comes from foundations, regional foundations, corporations, and individual donors. We receive zero government funding, so no Medicare, no Medicaid, no billing whatsoever to government sources. So we're completely reliant on these types of sources. And then, of course, we have an annual gala, which brings in about almost a third of our revenue for the year. It's something that a lot of people can get behind because, you know, oh, healthcare, some people might like that, some people might not. But when you're talking about a celebration of diversity in the St. Louis region, a lot of people can get behind that. And so we, on an annual basis, we go into a ballroom and we recreate a Mexican Latin town square there with dancers and musicians and traditional foods, with bands, really have a great time. And then we go to the other side of the ballroom and we have a sit-down dinner. This year it's Cuban cuisine, where we honor people who have done a lot of crucial work for the communities in St. Louis, and then have a formal award ceremony.
Neat. So this event actually is coming up in May.
May
is that
6th.
right? All right, and it's open to anybody.
It is. You can go to our website and you have the full information there about the event.
Zocaloco.
Zocaloco.
The Zocaloco.
It's like a Zocalo, which is the town square, and we're going to go loco. We're going to go crazy. So Zocaloco.
Sounds like fun.
It is a ton of fun.
So that's now so let's talk about you for a minute. So, so you've been president of Casa de Salud for
6 years.
6 years.
6 years.
And coming from a background totally different, where you were working in media, we were talking off camera. How is this this big switch in your personal career, but you're also giving back to the Hispanic community from which you came?
Yeah, absolutely. I enjoyed my doing television and radio for about almost 20 years, but I just kind of plopped accidentally into nonprofit management, and I found I really enjoyed it. And when this opportunity presented itself at Casa, it was very karmic, right? Because my family came to the United States from Cuba. So immigrants. I had very severe health problems as a child, and only because we had doctors in Tampa who donated their time, it's possible I wouldn't even be here without them. And so to have the opportunity to run an organization that gives back to a community that looked very much like my own community that I was born into is very, very satisfying.
That's really interesting. So you have a personal story and personal connection to the patients who are walking in the door every day.
Absolutely. Every day, you know, so we talk about trying to change people's lives. Every day at Casa de Salud, people's lives get changed. We had a person who came in and had a very high sugar level, diabetic. With our intervention, that person has lost 4 inches off their waist. Their sugar level has gone from diabetic level to normal level. And what he learned is now being spread to his family. So now his wife and his children are going to be affected as well. That's just one quick example. And now the next thing that we're doing is opening a mental health program so that so many people have mental health issues and have a very difficult time getting access to services. We're going to open up a collaborative at Casa de Salud working with other partners so that people who do not have insurance but need behavioral health can get access at Casa.
Very good. Top challenge for 2017?
A top challenge, I think, is going to make sure that the immigrant communities, which I think might feel a little bit under fire right now with some of the policies that are being talked about at the national political level, that they know that we as an institution continue to respect them and that we are there to serve them and to really make sure that their health care needs are taken care of.
Excellent. Very good. Thank you, Jorge, so much for joining us today and sharing the information about Casa de Salud. Visit casadesalud.org for more information on the organization. And there's more STL Live after this. Stay with us.